3-year-old Shih Tzu Maltese. Today I'll be talking about how to get animals out of their cage correctly and safely, and what to do with them once we've gotten them out of their cage correctly. Before I got Barry out of his cage, I watched how he was acting. He seemed to be calm and relaxed. Before you take the animal out of the cage, you must watch how it is acting in case it is scared, which might cause the animal to bite, which could cause an injury to itself, you, or even other staff members. When capturing an animal, our main priorities are to get the animal out of the cage safely and correctly. If procedures aren't followed correctly, this may cause hazards that could harm the animal, yourself, and other staff members as well. Before capturing the animal, you need to know what jobs are happening with the animal before getting them out. If it's either just a simple bath or grooming, or even if it's a surgery. In most clinics, there will be a clipboard on the front of the animal's cage saying the treatment that is happening to the animal and all the animal's information. Before getting the animal out, you should set up the workplace area before getting the animal out. This way you can just focus on the animal rather than focusing on trying to set up your work placement. Make sure when you get the animal out of the cage, you're holding the animal firmly to be sure the animal isn't going to jump out of the cage or jump out of your hands. Once you've gotten the animal out of the cage, you're to measure its vital signs. This is just simply by taking the dog's heart rate by using a telescope, placing it on the animal's chest. A normal reading for a heart rate is around 60 to 140 beats per minute, and also taking a respiration rate. This is simply by counting the animal's chest movements for 15 seconds and then multiplying that by 4 to get your results. After you've taken the dog's vital signs, it's always good to check for any unusual acting. This could indicate that the animal has a disease or illness. This is simply just by checking the animal if it's having difficulties breathing, coughing, nasal discharge, a fever, or just any signs of unusual acting that the animal or dog might be doing, which could indicate to those diseases or illnesses. And once you have done all those checkups on the dog and correctly taken the dog out of the cage properly, and any treatments you have done further on in that process, you should always put it in the animal's history file or on the clipboard on the animal's cage. This is so that all checkups and all treatments are in files